My name's Alan Hicks and I'm currently completing my PhD through the School of Medical Science here at Griffith, and this is my 3-minute thesis submission. Are you COVID positive and how do you know? In Australia, there are 14 recognised healthcare professions, and in 2010 the Australian government established the Australian Healthcare Professions Regulatory Agency, known as AHAPRA, to provide the framework governing these important occupations, which includes doctors, nurses, dentists, physios, and Chinese healthcare practitioners. However, they decided the medical scientists, those people who work in a pathology lab, didn't have enough patient contact or influence patient outcomes enough to recommended that they continue to self-regulate. Around the world, pathology lab workers are recognised as a healthcare profession, and this primarily involves maintenance of a practicing licence through continuing professional development. Also including in this registration framework are important public protections, allowing sanctions to be applied to any registered practitioner. This is not possible, however, in Australia, as there is no central register. There's no accurate number of workers in the field, the industry definitions are vague, and the scope of practice is 10 years old and not standardised. During the COVID-19 pandemic, the only definitive way to determine your COVID status is by a 6-hour procedure conducted by lab staff, with the pathologist responsible for reporting the result. In a survey of the Australian public, 48% of the respondents believed that pathologists conducted this testing. Currently, during the pandemic, more than 46 million tests of this type have been conducted in the US. And here in Australia, 3.2 million people have been tested, and more than 65,000 people in Australia in the last 24 hours alone. I'm sure that you are very aware that knowing your COVID status would directly affect your clinical outcomes and the level of care that you may require if you are admitted to a hospital. So the question my thesis poses is, why are Australian medical scientists self-regulated, where scientists from nations of a similar global standing are governmentally regulated? And I would like to ask you if you believe that pathology testing does not affect you, your family, or the greater community. Thank you for your time.